Hello friends, I am Dr. Vivek Dureja. After covering pure tone audiogram and impedance, now another important aspect of ENT practical as well as entrance exams are ENT instruments. So today we will cover some basic instruments, and in further videos we will cover tonsillectomy instruments, nasal endoscopes, rigid bronchoscopes and esophagoscopes, and flexible fiber optic scopes. So coming to instruments, this becomes nasal speculum. First thing they ask how to hold this is you hang it in your index finger using your middle finger and ring finger. You press the instrument, put it in nasal cavity and open the nasal cavity. It is basically used for anterior anoscopy. Main uses are
Uses can be described in terms of diagnostic and therapeutic. Diagnostic uses are for anterior rhinoscopy to examine the little's area, nasal septum, basically anterior part of the nasal septum, lateral wall of the nose, anterior end of inferior and middle turbinate, floor, pus in the middle meatus, rhinolith, foreign body, polyps, any septal perforations, and sometimes nasal masses. Therapeutic uses are removal of the foreign body, nasal packing, cauterization, application of the medication, antral puncture, during nasal surgery specifically for septoplasty and SMR for giving incisions only, and sometimes infiltration of the local anesthesia into the septum.
you can see these are nasal prongs of this instrument. These prongs are present in various sizes. This is a smaller one. Another nasal speculum that you should always have in mind is Killian's nasal speculum. You can see how it is structured. Similarly, these prongs are available in various sizes. This instrument is used not in OPD. Basically, it is used in operation theatre, for example, septoplasty, or if you are doing any nasal surgery, this instrument is used. So you should have a basic idea of this instrument. This is Killian's nasal speculum. This is Thuddicombe's nasal speculum. Another instrument is lax spatula or lax tongue depressor. It is having two plates. Both are roughly at right angle to each other. One is straight plate, other is curved plate. Usually we use this curved plate to handle the instrument. This plate is used to depress tongue. Various uses are
The uses of the lax tongue depressor can be described in terms of OPD use and OTA use. In OPD use, basically it is used for examination of the oral cavity and oropharynx. Number 2, for retraction of the cheek and lip. Number 3, in pressing the anterior pillar over the tonsil for detecting any pus or LOCG material. This is called Irvine-Murray sign positive. It is specifically seen in chronic tonsillitis. Number 4, to test the gag reflex. Number 5, during the posterior rhinoscopy also it can be used for depress the tongue. Number 6, during cold spatula test. What is cold spatula test? That is to know the patency of the nasal cavity. Number 7, that is for spatula test in case of suspected cases of tetanus to detect any spasm of masseter muscles present or absent. Number 8, sometimes for lifting of the soft palate is can be done by the curved end of this depressor. Sometimes also there is injection of steroids and proteolytic enzymes are done during in oral submucous fibrosis. And in few cases you can take throat swabs from the tonsils and postopharyngeal wall. In operation theatre it can be used during taking biopsy from the oral or oropharyngeal mucosa, excision of any cyst, surgery of the submandibular duct to check postnasal bleeding after septoplasty, SMR and FACE. During drainage of the quinsy also it can be used. Removal of the foreign body, throat it can also used. And if tonsillectomy done during in local anesthesia, it can also be used in case of adults specifically.
So this is lax spatula or lax tongue depressor. Coming on to next instrument, this is Jobson horn ring curette. So this is having two parts. One part is curette, there is a ring. Other part is for putting cotton over it to clean ear. Various uses of these instruments are
the curette part used for removal of the wax, foreign body, granulation from the external auditory canal, whereas the probing part or the cotton carrier part used for probing the polyp in the external auditory canal, or it is arise from the middle ear. Number 2, for oral toileting, to clean the ear discharge. Number 3, to trace the sinus tract. Number 4, application of the medication in external auditory canal.
So this is Jobson horn curette. Next instrument is tuning fork. You should know something about tuning fork. These are prongs of tuning fork. This is shoulder of tuning fork, stem of tuning fork, base of tuning fork. When we strike tuning fork, we strike at the prongs of tuning fork, and we keep the base of tuning fork over the ear, over the mastoid part of the patient. These tuning forks, you can see very well, it is written 512, means 512 frequency. In ENT, we use 256, 512 and 1024 Hertz tuning forks. These help us in determining the type of hearing loss and the degree of hearing loss. So this is tuning fork. You should always be able to understand which one tuning fork we should suggest, we should select if we have to select from these three. So it is 512. Reason behind that is, first, it matches your speech frequency. Second, the overtones are less in 512. Decay time is also optimal. So this is tuning fork. This is another instrument. This is ear speculum. Uses of this instrument are
this is called Toynbee oral speculum. Its uses can be described in terms of OPD and in case of operative procedure. In OPD, it is used for examination of the external auditory canal and tympanic membrane. In external auditory canal, it is used for the removal of the wax, foreign body and otomycotic debris. To see the tympanic membrane, various diseases like any retraction pocket, any congestion, any perforation or any granular meningitis cases, you can see. Number 2, in operative procedures during myringotomy or during myringotomy with grommet insertion, during polypectomy, granuloma removal, foreign body removal under anesthesia. These are the procedure where it can be used. Why it is black color? Because it prevents reflection of the light to surgeon's eye from the operating microscope, and always it should be inserted into the cartilaginous part of the meatus, should not touch the bony meatus as it is very sensitive and can be painful, and it is gently inserted into the ear by rotatory motion.
When we are using this instrument or any ear speculum during OPD, suppose, we always hold this instrument in non-dominating hand so that our dominating hand is free for any instrumentation. Suppose I want to clean ear, so I will put this and I will clean it. So coming on to another instrument, this is Mollison's self-retaining mastoid hemostatic retractor.
It is why it is called self-retaining, as no assistant required to hold this, and there is it secure hemostasis by lateral pressure over the tissues. Number 3, it retracts away from the field of visions. Use number 1, retract the skin edges and deep tissue. Number 2, during harvesting of the temporalis fossa in case of tympanoplasty or mastectomy, sometimes in facial nerve decompression. It can also be used during cochlear implantation to retract the tissue. Other use, it can be used during laryngofissure, borehole craniotomy, external ethmoidectomy, external optic nerve decompression, and also sometimes during tracheostomy.
Another point to understand about this instrument is, it is not having any spring mechanism. We put these prongs over the skin or over the tissues, we press it, the tension of the tissues, that acts as spring mechanism. This instrument itself is not having spring mechanism. So if I am pressing this, it will not itself close. But when we use in surgery, because of tension of tissues, the moment I press this thing, it closes. So you should always know the spring mechanism is because of tension of tissues, not because of any mechanism present in this instrument. Next instrument is Kleine-Sausser's laryngoscope.
There is a light carrier There are other types of laryngoscopes are also available. These are, one is Chevalier-Jackson and another is Negus. Depending upon the illumination, if it is distal illuminated, then it is called Chevalier-Jackson. If it is proximal illumination, that is called Negus. But this is specifically designed, that is used for microlaryngeal surgery. This is called Klein-Susser direct laryngoscopes. Its use can be described in terms of diagnostic and therapeutic use. Diagnostic use for the examination of the larynx and hypopharynx, and also hidden areas of larynx which cannot we usually see in indirect laryngoscopy, like your laryngeal surface of the epiglottis, anterior commissure, piriform fossa, ventricle, and sometimes subglottis. And you can also know the extent of growth, and you can also take biopsy. Therapeutic use like foreign body removal. Number 2, removal of the any benign lesions of the larynx like papilloma, polyp, cyst, etc.
They ask question that how do you hold this instrument? Always know when we are doing any surgery, we hold this instrument in non-dominating hand. We introduce the scope, we hold it in non-dominating hand, we lift the scope, we visualize, and using our dominating hand. Suppose I am right-handed person, I will use my right hand to, suppose I want to take biopsy or want to do suction, I will do with it my dominant hand, and scope will always be held in non-dominating hand. This question is usually asked in PG entrance exam also. Coming on to next instrument, this is Walsham's forceps.
Walsham forceps used to refracture and disimpact the fracture line first, and then realignment of the fracture done. And there is another forceps is called Ash forceps, which is used basically to elevate and straighten the septum, and it is introduced on either side of the septum, and there is a basically gap seen between the blade when approximated.
So you can see gap both between the Ash as well as Walsham's. Now, important point is how will you differentiate these two instruments during your exam, or if suppose in postgraduate exam you are given images of these instruments. So two things. Ash is used for septum. Both sides are almost symmetrical. So both blades are symmetrical in Ash. Walsham is used for lateral wall of nose. Lateral wall of nose is not symmetrical on both sides. On one side there are middle turbinate, soft tissue. On the other side there is nasal bone. So you can see both the prongs are of different shape. So first thing is you differentiate on this base. Same size, same shape prongs. Different size, different shape prongs. Second thing, Ash forceps is curved. Walsham's is straight. So these 2 points you always keep in mind before differentiating these two instruments. Ash is curved, Ash are symmetrical prongs. Walsham is straight, but prongs are of different size as well as different shapes. Sometimes you will even see a rubber covering any one of these prongs. That is to prevent direct trauma from this metallic instrument to soft tissue of the nose. So suppose if one of the prong is covered with a rubber, some tubing is there over this, that means it is Walsham forceps. Coming on to next instrument, this is Freer's elevator.
Its use is to elevate the mucoperichondrium and mucoperiosteum in septoplasty and SMR. Number 2, during harvesting the temporalis fossa in tympanoplasty and also mastoid exploration, it can be used. In rhinoplasty, the harvesting of the cartilage, also it can be used. For fracturing of the inferior turbinate during antrostomy, it was used previously. It can also be used to remove the maxillary crest in case of SMR. Also in Caldwell lock operation, it is used for the elevation of the mucosa.
Freer's elevator is available in various sizes. This is a smaller one. Even larger Freer elevators are available. So by this we finish some of the ENT instruments. Other ENT instruments will finish in further videos. We'll have a quick revision. Freer's elevator, Ash forceps, straight prongs, similar prongs, Walsham elevator, no curvature, different size prongs, Kleine-Susser's laryngoscope, along with light carrier. Mollison's self-retaining hemostatic mastoid retractor, ear speculum, tuning fork. This is 512. We use 256 frequency, 1024 frequency to quantify hearing loss. Jobson's horn curette, lax spatula or lax tongue depressor, nasal speculums, Tudicum's nasal speculum. These are of various sizes. Killian's nasal speculum prongs can be of various sizes. Thank you.